So good morning, ma'am. I am Jan Queen G. Enriquez, and for today I will perform the assessment of vital signs. So first, I will introduce myself to the client. So good morning, ma'am. My name is Jan Queen G. Enriquez, your student nurse for today. What is your name, ma'am?
Laura Jane Gonzalez.
Date of birth.
April 24, 2003.
So how would you like me to call you? Nickname?
Lars.
First, I will close the windows for privacy, ma'am. And before anything else, ma'am, I will just wash my hands first for proper hygiene. So for today, ma'am, we will assess your temperature to know that it is within the normal range. And if it is not in normal range, we can give you immediate care. So it is okay for you, ma'am. Okay, before we start, did you eat something before you arrived here?
Yes.
How long ago was that?
About 30 minutes ago.
Okay, so it is safe to take your oral temperature. So, do you have any surgery before with your axilla or your underarm?
No?
Okay, so we will gonna use a digital thermometer. So, do you know how to use one?
Yes.
Okay, first we will clean our thermometer. We will start from bulb to stem. With the use of alcohol and cotton. So first, we will take the oral temperature of the client. Okay, ma'am, we'll first take your oral temperature. Can you open your mouth, please? So I will place the thermometer tip under your tongue in the posterior sublingual pocket. Okay, close your mouth, ma'am. Okay, so your oral temperature is 36.1. So after that, we will clean the thermometer starting from stem to bulb, because the bulb now is the dirtiest. Okay. And after that, we will put it in its location. Okay, ma'am, so let's move on to the assessing of the temperature in the axillary. First, for the axillary method, we will move your sleeves up. So can you raise your hands, ma'am? We will inspect for any lesions. And after that, we will pat the axilla if it is wet. And now we'll place the thermometer at the center of the armpit. Close it and turn it on. We'll just wait for the beeping sound. And now we hear the beeping sound. So her temperature is 35.6, which is normal, and we will record it. After that, we will clean the thermometer from stem to bulb and put it back to its location. And after that, we will document the temperature of the client. So let's move on to the assessing of the peripheral pulse. So before we will assess the peripheral pulse, the first step is we must perform the steps 1 to 3 of assessing the temperature. And after that, the equipment needed for this is the watch with second hand. So we need to select the pulse point. There are 9 pulse points, which is the temporal, the carotid, the brachial, the popliteal in the lower extremities, the pedal, the posterior, the tibial, the radial. Here is the radial in the wrist, and the popliteal pulse here. So first, I will choose the radial pulse of the patient, which will be found in the wrist. Okay, so are you okay in that position, ma'am?
Yes.
We must assist the client in a comfortable position before getting the pulse. So now we will palpate and count the pulse. Count for 30 seconds and multiply it by 2. Record the pulse in beats per minute. Pulse is normal. Okay, let's start, ma'am. So it is 32, so multiply by 2 is 64. Your peripheral pulse is 64, and I will just document it. Okay, let's move on to the assessing of respiration. Okay, so the equipment needed for this is the watch with second hand indicator. So place the hand of the client to her chest and feel the movement. And observe or palpate and count the respiratory rate. Count the respiratory rate for 50 seconds, and an inhalation and exhalation counts as one respiratory rate. And observe the depth, rhythm, and character of respirations. Observe the respirations depth by watching the movement of the chest. So observe the respirations for regular or irregular rhythm. Observe the character of respirations or the sound they produce and the effort that they require. Okay, time is up now. And after that, document the respiratory rate. Your respiratory rate is 15 breaths per minute, which is normal. So I will just document it. Okay, so let's move on to the assessment of blood pressure. So first, we will check for the equipment, and we will make sure that the equipment is functioning properly and it is all intact. So the equipment needed for this is the sphygmanometer and the So before we start, we will just ask the clients if she feels any pain. So mom, do you feel any pain?
No.
Okay mom, so I want you to sit properly, and we will have the elbow flex with the palm up. We're gonna roll the sleeves first, and I will place my finger here to check for the pulse, and then we will put the cuff. So we'll palpate the brachial pulse with the use of our fingertips. So first, we'll palpate the brachial artery with our fingertips and close the valve on the bulb. And after that, pump the cuff until you no longer feel the brachial pulse. And release the pressure completely on the cuff and wait for 1 to 2 minutes before making any further announcement. So and after that, deflate the bulb. And first, we'll cleanse the earpiece with an antiseptic wipe. And after that, insert the stethoscope in your ear. And ensure that the stethoscope hangs freely onto your diaphragm. Place the bell in the brachial pulse of the client. So we must place the stethoscope on the skin, not on the clothing. And after that, hold the diaphragm with a thumb or your index finger. So, okay, let's start. Okay, first we'll close the bulb. Pump the cuff until the brachial pulse disappears. So it disappeared at 180 mmHg. Okay, the first phase of the carrot cuff is the tapping sound. The fourth phase is you hear the muffled sound. Phase is the end, or the sound will disappear. So deflate the cuff rapidly and completely. So after that, we will repeat the procedure on the client's other arm. So we'll just repeat the first process. Okay, so your blood pressure, ma'am, is 120/80, which is normal. And after removing the cuff from the client's arm, we will wipe it with some antiseptic wipes or disinfectant. And after getting the blood pressure, we will document it. Okay, ma'am, your blood pressure is 120/80 and it is normal.